Mildred today, who is now 5 days after surgery.
Yes.
Now, as you can see here on her leg, she has an incision. It's a few inches long here on the inside of the leg, and we use that to access the soleal sling to get to the tibial nerve. And her symptoms initially were pain that was actually on the bottom of her foot. She was getting discomfort down there, numbness, tingling, and pain with ambulation. Is that about right, Mildred?
That's correct.
And what was your pain level on a scale of 0 to 10, with 10 being god-awful and 0 being none?
Probably about an 8 most of the time.
Most of the time. Was it worse with exercise or moving or walking?
Moving, it would bother me a little bit more, but when I sat down, it would, my leg would actually just go numb.
From the whole leg would just
Yes,
go numb?
go numb.
Okay. Have you had any numbness symptoms since then as far as your leg going numb?
Not since the surgery, no.
And was it immediate?
Yeah, basically, I haven't had any pain from the surgery. I haven't, but the actual numbness and the feeling in the leg, like when I sat down and put the leg on the floor, I don't have that anymore.
Yeah, and so for people who don't understand this or have this problem that it gets misdiagnosed or not diagnosed, what's happening here is the nerve that sits behind the muscle of the gastrocnemius and the soleus muscle gets entrapped. And every time that foot moves through a range of motion, it actually compresses the nerve underneath the muscle and gets caught in what's this little soleal sling. So when So when we actually perform the surgery, what I do is I tunnel down to the nerve between the two muscles, identify the nerve, and then I'll actually release the tissue around there, and I'll put my finger right where the nerve is, and I'll dorsiflex the foot to feel the compression on there. And then once it's released and I feel I'm not getting that compression anymore, the surgery is essentially done. It takes about 20 minutes or so, 30 minutes. And as you can see, we're now 5 days out, and we've had complete relief. And that is typical of this procedure. So I just want people to be aware of this problem of the soleal sling affecting not just the calf muscle here, but also the whole foot and leg. And this is something that has to be differentiated from tarsal tunnel syndrome. Because as you can see, we didn't touch anywhere down there. And initially, her diagnosis was tarsal tunnel syndrome by her previous physician, and she had therapy which failed. And I actually sent her to therapy as well, specifically targeting that area, which provided some relief, but nothing sustainable. So now, here's where we're at. Thank you.